Hi everyone, this is Dr. Hatami. In this short video, we're going to talk about the adrenal glands, another pure endocrine gland located on top of each kidney. As you can see in this picture, we have kidney here, and on top of each kidney, we have this endocrine gland. If you look at the adrenal gland closely or cut it open, we can see two distinct regions. The outer region is called adrenal cortex, and the inner region is called adrenal medulla. These regions are different in their structure and also in their function. Adrenal medulla, which is the inner region of the gland, it responds to nervous signals and is part of the sympathetic nervous system, which is responsible for body's fight or flight response. The adrenal cortex, which is the outer region of the adrenal gland, it would be controlled by hypothalamus pituitary axis. So hypothalamus is going to releasing hormone, which is called corticotropin releasing hormone. Corticotropin releasing hormone is going to stimulate the anterior pituitary gland to release adrenocorticotropin hormone or ACTH. So then adrenocorticotropin hormone is going to stimulate the adrenal cortex to produce its own hormones. Now let's take a look at the adrenal cortex of the adrenal gland and see what are the hormones that this part of the adrenal gland is producing. So the cortex has 3 layers, which each producing different hormones. The outermost layer is called zona glomerulosa. The middle layer is called zona fasciculata, and then the inner layer is called the zona reticularis. So based on the orientation of the cells, we call them as these glomerulosa or fasciculata or reticularis. So zona glomerulosa, which is the outermost layer, is going to produce the aldosterone. The aldosterone hormone is a hormone that regulates the blood pressure and electrolyte balance. Whenever the blood pressure is low, the aldosterone would be released and is going to stimulate the kidney to reabsorb sodium and excrete potassium. And this process works together with renin, angiotensin, aldosterone system to maintain blood pressure. Then the middle layer, zona fasciculata, is producing glucocorticoids group of hormone, mainly cortisol, often called as stress hormone. These cortisol help the body cope with stress by maintaining blood pressure and energy supply. It also regulates metabolism and support tissue repair and increases blood glucose by breaking down protein and fat. However, like if you experience stress a lot and chronically high cortisol level can lead to high blood sugar and other health issues. So let's get to the zona reticularis and what is the hormone made by zona reticularis. Zona reticularis, which is the innermost layer, it produces androgens. Let me just add here androgens, which are male sex hormones. So that's the reason even in female, low level of androgens are produced by this layer because basically the androgens or sex hormones like testosterone, it's going to be produced by testes in male. But in female, always we have a low level of androgen that is coming from this zona reticularis layer of adrenal cortex. And then for the medulla, which we said it would be associated with the sympathetic nervous system, so or fight or flight response, the hormone produced by the adrenal medulla is like epinephrine and norepinephrine, which we call them as catecholamine, are very similar to the neurotransmitter produced by sympathetic nervous system, and these are the hormones produced by adrenal medulla. Now let's talk about some conditions related to the adrenal gland. Let's start with the Addison disease. So Addison disease is an autoimmune disorder, which means the body's immune system destroys the adrenal cortex. This leads to low cortisol and aldosterone levels. So these people, symptoms would be they're feeling fatigue, um, they're gonna lose their weight, they have low blood pressure, craving for salt, and also hyperpigmentation, which you can see dark patches on their skin, especially in their face. Then another condition related to the adrenal gland, it's because of the too much cortisol. So Addison disease is somehow like low cortisol or hypoactivity of the adrenal gland or hyposecretion of the cortisol and aldosterone, while Cushing syndrome is hyperactivity or high level of cortisol, which may result from long-term steroid use, adrenal tumors, or even pituitary gland disorders. So symptoms include moon face or round face. The fat would be accumulated on the upper back, which is called buffalo hump, and abdominal weight gain, thin arms and thin legs, purple stretch marks, and also they experience high blood pressure. Okay, so in summary, the adrenal glands are vital endocrine glands that help the body respond to stress, regulate blood pressure, maintain electrolyte balance while also producing small amount of sex hormones. And understanding these glands and their hormones helps us see how important they are for overall health. And now let's finish this video with one question in asking which hormone is secreted by the adrenal cortex in response to stress. Because we know the adrenal cortex has 3 layers and they are producing different type of hormones with different function. But this one is specifically asking which one or which hormone would be produced in response to stress. That is the cortisol hormone. It's easy to guess, right? Because everybody knows that cortisol and stress is they are related together. But let's look at the other option as well. Melatonin is not even the hormone made by adrenal cortex. That is a hormone made by pineal gland. And then testosterone is the hormone basically made by testes in male, but in female, even we have a low level of testosterone because it would be produced by the zona reticularis of the adrenal cortex. Then insulin is the hormone made by pancreas. Thank you for listening.